getting started, my name is Elise Lopez, and I work for the University of Arizona in the College of Public Health, where I direct the sexual violence prevention research programs. And I work there with Mary Koss, and we're the evaluation team for the Arizona Safer Bars Alliance. And the Arizona Safer Bars Alliance program is actually run out of our state health department, the Arizona Department of Health Services, up in Phoenix, Arizona. So we work in partnership with ADHS to develop, implement, and evaluate this bar bystander program. And this presentation is going to assume that most people here have an active understanding of what the bystander effect is and what bystander intervention is. So can you just raise your hand real quick if you've heard of bystander intervention, you know something about it? Okay. So most people in the room know about bystander intervention. Bystander intervention is basically training folks to recognize and intervene when they see an emergency situation or a situation where things just maybe don't seem right. And so what we're doing with the Arizona Safer Bars Alliance is training bar staff to recognize and respond to sexual aggression that's perpetrated in bar environments. So that's what we're in the business of with this program. Now, ADHS started developing this program in 2007, so it's been around for a little while. Most of the background development on this program has already been presented at the National Sexual Assault Conference back in 2013. So this presentation is going to go over some of the background and how the program was developed, but mostly we're going to talk about lessons learned from it, and more specifically, we're going to talk about strategizing with this type of program around college campuses. That's where we're headed today. I'm going to tell you a lot about our experiences, but I also want to bring it back to maybe what you're experiencing or thinking about for your own communities as well. So ASBA's been around since about 2007. And since then, we've gotten a lot of calls and emails from folks who've heard about the program and said, how do I get this started in my community? What do I do about that? This is a very limited list of states and communities. We've heard from people around the world. We've heard from various branches of the military about how do we get this started. But it's kind of a big project, and people get really, really excited about it. Let's start a bar bystander program. This is fabulous. We've never heard of this before. It sounds really amazing. Let's do it right now. Okay. We all want to do all the things, and we get very, very excited and passionate about it. That's why you guys are still here at this session on the last day of a conference on a Friday morning, right? Okay, bar bystander is a really cool concept. We're going to talk today specifically about centralizing it around college campuses. So like we heard at the plenary a few days ago during our keynote speeches, this is our moment, really, in sexual violence prevention. There's a lot of energy right now around prevention and response to sexual violence. And a lot of where that momentum is around college campuses and dealing with campus sexual misconduct. How do we prevent it? A lot of campus prevention programs right now are focused on educating students, right? So we want them to know about the issues. We want them to know what to do if they're assaulted. We want people to take responsibility for their behavior and for their actions and their relationships. So we're spending a lot of time at the individual level with students. This is good. Prevention efforts are great. But we also want to look at the larger context of where students spend their time. We know students go to parties. We know students have social groups that they hang out with. We also know that a lot of students hang out in bars around their college campuses. Right now, with so much energy around campus sexual misconduct, it makes sense, if you're going to start a bar bystander program, to start with those really high density areas around college campuses where you know there are a lot of bars. There are a lot of bars that probably have environments that facilitate sexual aggression, and you have high risk populations that are going to those bars and may not have the skills that they need to always be able to recognize what sexual aggression looks like in a bar. Most adolescents who are turning 21, turning 22, 23, going to bars might not be looking out for sexual aggression all the time, or might not know what to do if it happens in a bar. This is a very new conversation that we're having. In the past, it's always been in bars, people take care of themselves, or people go to bars looking for a date tonight, so why should we do anything about the sexual atmosphere of bars? And the way we come back at that is, yeah, a lot of people go to bars to have fun. A lot of people go to bars to drink. Somebody may be going to a bar looking for a sexual partner for that night, and that's perfectly fine. But it doesn't mean that they want any sexual partner who wants to touch them on the dance floor or take them home that night. People still have a choice when they go to a bar about who they're going to go home with that night, if anyone, right? So sexual aggression in bars, is it a thing? Is it a thing? I mean, you know, we go out to do this program and our experience has been, well, it's not sexual aggression, it's flirting. We get that a lot. And if you're starting a bar bystander program, you're going to get that a lot too. Most bar staff have not been trained. Most regular people have not been trained or have experience with what's the difference between sexual harassment and flirting. How do you tell the difference, right? But what we know from the scientific literature, and this is just a very, very, very extremely small snapshot of it, is that sexual aggression in bars happens. It happens in very specific ways. And alcohol can make it worse. Alcohol can also change the way that people interpret social cues. So it's not always that a woman is saying no or isn't saying no. It could be that somebody who is drinking may not be recognizing those cues very fast or may also be misinterpreting them. So we have a lot of scientific literature that talks to us about what sexual aggression looks like in bars. We have a lot of literature that talks to us about what might make people more likely to be victimized or to perpetrate sexual aggression in a bar setting. We have a lot of knowledge about how alcohol is related to sexual violence. What we don't have is evidence-based practices that tell us how to deal with sexual aggression in bars. But we do have a separate literature that tells us, hey, bystander intervention is a really good way of preventing sexual aggression from escalating into assaultive behavior. So we have all of this different literature that tells us all these different things. We have alcohol and sex. We have sexual aggression. We have sexual aggression in bars. We have bystander intervention. And what we've done with this program is really bring it all together. So looking at alcohol as a factor for increasing perpetration risk. Looking at alcohol as something that increases victimization risk. So alcohol is not a causal factor for victimization or perpetration. I'm just going to put that out there right now. Not everybody who drinks will perpetrate sexual violence. Not everybody who drinks will be victimized. But what we do know is that in situations where there's a lot of alcohol and where we know that there's a highly sexualized context, like in a bar, you're increasing those risks by bringing all these factors together. We also know that bars are hotspots for police reports. Now, that's not always around sexual violence. Often it could be around other types of conduct problems. So bar fights, throwing glass bottles at people, various things like that, somebody not wanting to pay their bill, etc. But we know bars are our hotspots. We also know that sexual violence reports are often, when they're around college campuses, they're often centered around those little rows where you have high densities of bars as well. So these are our real dense places where you have tons and tons of bars, maybe on 1 or 2 blocks, and you're going to see a lot of police reports. So if you look at 24-hour police reports, if you have this in your city that you live in, you can look and see if there's a GIS mapping. A lot of police reports or police departments are doing this now, where they will GIS map police reports from the night before, the week before, the month before, etc. And you can look and see what types of reports have been made. And around those hot spots, or around those spots of bars, you're going to see hot spots of reports of violence. These are a place that we can target for prevention. So let me tell you a little bit about the background of our program, the Arizona Safer Bars Alliance. This program is centralized out of our Arizona Department of Health Services, and it's funded through RPE, Rape Prevention and Education funding from CDC. And the program really came out of focus groups that we did when we were developing our state prevention plan back in 2007. So we had these focus groups with folks all around the state in general about prevention. What should our state be focusing on in our prevention efforts? And one person in there happened to be a bar owner, and he said, you know, I really think that you guys should train bar staff in this. Train our bar staff in sexual violence prevention. And we said, oh, That does sound like a really good idea. Let's talk about that more. And so we explored that more. We held even more focus groups, did a lot of community surveying, and started to develop the program. And that was way back in 2007. Since then, we've really developed it beyond a simple curriculum to being an actual alliance of bars. So that's the name Arizona Safer Bars Alliance. So we have an alliance with alcohol serving establishments. We also have partners with law enforcement in the 3 major cities in Arizona, where we have police officers and other enforcement officers who've been trained in our curriculum so that they know, they know what training certain bars have had and which bars haven't been trained. We also have law enforcement officers in some communities who've been trained to be trainers, so they can actually go out and build their own grassroots efforts of training and partnering with alcohol serving establishments as well. We also have a really strong partnership with our Arizona Department of Liquor Licenses and Control, and this is really huge for us. Having a partnership with the licensing agency in your state can be a huge asset, because the Department of Liquor Licenses and Control is the end-all be-all for licensees in your state. They are the ones who come up with training, who come up with licensing requirements, who enforce those requirements. And so having that support and having that top-down communication of this is important in our alcohol serving establishments in Arizona has been a huge asset to us. It also really helped us to have that partnership because we could be informed of what the alcohol laws are in our state. They change pretty regularly. And so being able to have that partner who can keep us informed of what's going on in the alcohol policy world helps us with our ongoing development of the curriculum as well. So what the program has grown into is a multi-session adult bystander intervention program for bar staff. So it is multi-session, 2 sessions held 2 to 4 weeks apart, and each session is 3 hours long. And it didn't originally start that way. I know a lot of communities that are starting bar bystander programs maybe are able to get a half hour with bars. It's been a really big challenge for other communities to get bar buy-in. And we're going to talk a little bit more today about how do you get bars to buy into this? Why would they even do this? Why would bar staff volunteer their time to sit in a training about something that they might not see as part of their job description? How do you do that? We're going to talk more about that today. We are at a point where we're able to get bars to say, yes, we're going to commit 6 hours of our staff time to training because we think this is important. So how did we get there? More recently, the University of Arizona partnered with the Department of Health Services to really take a look at refining the curriculum, working on strategizing for implementation, and then also really creating a robust evaluation, because this hasn't been done before. And that's something that's really key to remember, is that this is not an evidence-based practice. We don't know that it works, but it is theory-informed, and it is research-informed. So we have all of this great information from research that tells us what we should be doing. Now we're going out and trying to implement it and evaluate it to see, are we on the right track with this? So we're going to talk, too, more about what type of evaluation we've done with this program. So this program is really based around sexual violence prevention recommendations out of CDC. So we've gone through CDC's literature on prevention and figured out how do we make our program be in line with best practices. So looking at things like CDC's report on connecting the dots, which really looks at community, individual, and relationship risk factors and protective factors, looking at community assets and how do you build those into your program. We've looked at more recent publications that have come out of CDC on alcohol serving establishments and alcohol policies and how that affects sexual violence. If you have not read Lippy and DeGue, 2014, out of CDC, you need to. Read it, love it, live it. That publication that came out last year out of CDC really centered around alcohol policies and why we need to move to an environmental level. When we're talking about alcohol and prevention of sexual violence, we're not just going out and saying, hey, people, don't drink so much, then you won't get raped. It's not just saying, hey, don't go out and drink so much so you don't rape people. It's also looking at, hey, we need to also consider the context of alcohol policies and how those upstream factors affect people's lives. Because when we're in a context that's highly sexualized, when we're in a context where people have access to alcohol where they can binge drink at high rates, or where people aren't looking out for each other when they're experiencing maybe cognitive distortions because of being under the influence of alcohol. We're not looking at upstream approaches, and that's where we really need to be moving. And so one of the things CDC is looking at is how do we get out into the societal or environmental level and look at those contexts that affect people and their drinking behavior and their sexual aggression and sexually assaultive behavior. So we've developed this in adult learning theory. It is a multi-session curriculum because we know that giving people maybe an hour of training one time is not going to change their lives, right? They might know a little bit more about sexual violence, but they're probably not going to change their behavior. So we've taken care of that by having several sessions a few weeks apart so that information has time to sink in. People can start to see maybe how it's affecting their life before they come back to the second session. And then throughout that second session, we work on strategies for recognizing and responding to sexual aggression. We have a perpetration focus in our program. This is really important to us because part of the norms change in bars is talking to bar staff about it is not what somebody is wearing. It's not how many drinks somebody ordered. All of those things that bar staff often start out in the training saying, well, you know, somebody came here to drink. They came here wearing these certain types of clothes. Why should I intervene when somebody starts touching their body? They obviously wanted it. Part of that norms change is changing the dialogue on what's going on in bars and taking a perpetration prevention focus, is that we're teaching them how to recognize sexually aggressive behavior that's being perpetrated in a bar environment. Taking that and saying, let's recognize perpetration, let's find ways to hold people accountable for those aggressive behaviors so that it doesn't lead or escalate to an assault later. And so in our program, we also target individual, relational, and environmental level factors. So we're talking about not just changing bar staff themselves, but then also changing how they relate to their patrons and how they change the culture of their bars. Right now, we're aiming our program at areas that have a really high density of alcohol serving establishments. So in Arizona, we have 3 major cities. We have a lot of very small rural communities as well. Right now, our focus is on training those areas around our college campuses that have those bar rows, maybe right next to the campus. They're highly accessible to students, and they're those places that very easily facilitate sexual aggression. We've also designed our evaluation so that we're looking at behavioral outcomes. Because we know from research that only looking at knowledge and attitudes does not necessarily indicate success in prevention. I might know a lot about the benefits of eating a salad, but I'm probably going to have a cheeseburger for lunch. Changing knowledge and attitudes does not necessarily change behavior. And when we are doing prevention, we need to look at behavior change over time. That's one of the things that we're starting to implement this year with our evaluation. We don't have new data yet on it, but that's something that we've really been working towards, is figuring out how do we rewrite our evaluation so that we can actually see, is this changing people's lives? So what exactly goes into a bar bystander training program? What do you guys think? That's what I want to know. So if you were developing bar bystander training, what would you put in it? Right. Well, you know, it could be like recognizing escalation tactics that a perpetrator is using. So, but you know, de-escalation tactics, yes. Right? So how do you de-escalate a situation that's going on in a bar? Absolutely. What else? Yeah. Right. Recognizing. Because you can't intervene if you don't even know there's a problem. Yes, in the back. Rape culture in bars. Absolutely. Right? So looking at what's the culture of your bar? Is your bar facilitating sexual aggression in ways that you might not recognize, right? You might not recognize that your wet t-shirt contest and your 25-cent drinks for women and no cover charge for women might have a little something to do with facilitating sexual aggression. They might not be thinking about that. Absolutely. What else? Right, so you have to change the attitudes of the bar staff, absolutely, because they set the tone for the culture of the bar, and they're also the people who are going to intervene or not intervene when they recognize a situation. If they don't feel like it's important, they're not going to do anything, right? Way in the back. Yes. So, victim blaming myths, absolutely. What else? Right, so encouraging reporting and response, right? If all the bar staff are trained to respond, they're going to recognize and respond. That's fine, because then, they can recognize situations and they can respond, but they're not always going to see every single situation. On a busy Friday night at midnight, they have a packed bar. They might not see everything. So how do patrons know that they can report? And in that busy bar situation, how do we train bar staff so that they know what to do when somebody reports to them and that they're actually going to take it seriously as well, right? What else might we want to teach bar staff? Yeah. Consent. Oh man, being left-handed, I tell you, with writing. Sorry, that says victim blaming. Consent, yes. Bar staff need to know what consent is, especially in this very interesting context where you might have people meeting new people or switching partners a lot on the dance floor or sitting at the bar with somebody they just met and having a lot of drinks. What does consent look like in those situations, right? Because this might also not be a situation where they can hear what's going on, right? So how do we also look at other types of consent? Yeah. Rape trauma syndrome, absolutely. Yeah, we need bar staff to understand what's going on with folks. Absolutely. Yeah, if you're the rapey bar. Right, so what does that do to your business and people actually wanting to come to your bar? And also, what does that do to your liability for your alcohol license? Absolutely. I'm going to talk a little bit more about that later. Any other burning desires for components in a bar bystander program? Yeah, drug facility. Yeah, right. Yeah, so drug facilitated sexual assault is an important component as well, right? And we get that question a lot too. What does that look like? Yeah. Ways to intervene. Right. Because they might know there's a problem, but they might not have any idea, what do I actually do about this problem? And do I intervene the same way every time? Because most bar staff aren't trained in prevention. They're trained in response. They're really good at calling law enforcement when things get out of hand, but how do we teach bar staff to recognize something and intervene before it escalates, right? If we can prevent escalation to assault and prevent having to call out LEs, then that's pretty good. That's a win, right? Anything else? Yeah. Ownership buy-in. Right. So what happens in a bar if their staff are trained, they really want to intervene, they know sexual aggression is going on, but their owner or manager says, you're not allowed to leave from your post in this bar to go intervene. Or I don't want you to intervene because what if it escalates and you approach somebody and then they punch you in the face, right? What if the managers and owners don't buy in to intervening? We got to talk about that. All of this stuff is stuff that comes up during bar bystander training. Every component you guys listed is important, and all of these are components of our bar bystander program. So when we did focus groups to develop the program, we worked with both patrons and bar owners, managers, and staff in communities around Arizona. And they actually kind of ranked things that they thought were important differently. So our bar staff really wanted training on alcohol and drug facilitated rape. They wanted to know their role. What exactly is our role in sexual violence prevention? They wanted to know about bar policies. Do we need to have a policy that's written for preventing sexual assault? They wanted to know definitions and scope. What does sexual assault look like? What is sexual aggression? How do I know the difference between sexual aggression and flirting? They wanted to know, what exactly am I supposed to be doing here? Our patrons also wanted bar staff to be trained on alcohol and drug facilitated sexual assault. They also wanted resources and tools for patrons. So they were getting back to that idea of, what if I'm experiencing something, nobody's intervened yet, but I feel like I need to talk to somebody about this, or I feel like I need to let them know that there's a patron who's weaving in and out of the dance floor, touching people's butts. What do I do about that? Resources, that's what they wanted. They also wanted bar staff to have observation techniques. Patrons were very aware that, you know what, when I'm drinking in a bar, I might have my beer goggles on. I might not be able to watch out for myself as best as I want to. I would really love it if bar staff were trained in how to observe the crowd and watch for sexual aggression. And so we had some discrepancies in here. For example, bar staff didn't think that gender socialization and renorming was very important. But what's kind of funny is that when we're in practice with this training, that's what's going on with them. When we say it out loud in that way, they're like, oh, no, that doesn't have anything to do with us. But really, when we start getting into these conversations of the things they're seeing and experiencing in their bars, this is what they're really wanting to do as well. So it's been a really interesting experience. And all of this is stuff that has gone into our training. So we really start out with, in that first session, talking through those definitions, talking through the state laws and talking through liability, talking through what's the difference between sexual harassment and sexual aggression and flirting. How do we recognize those things? And it's in that process that they start to do that culture shift and start to get those wheels turning about what they see in their own bar environment. Most bar staff that come into this program aren't choosing to be there. Their owner or manager has said, we want to do this in our bar, show up on Sunday morning at 10 o'clock for 3 hours. A lot of bar staff don't really want to do that. They're not choosing to be there. So they come in a little bit grumbly, a little bit defensive, because usually the person training might not necessarily be somebody who's been a bar staff before. So imagine if a stranger came into your job and started telling you how to do your job, right? You'd be a little defensive about it. I would. Most people would. And so bar staff, they own their territory. They're very connected to their bars. It's their space, And so coming in with respect for that and using that knowledge is part of adult learning. Talking to them about, tell me about your bar. What's your culture? What role does your bar play in the community? Building those relationships is super important at the beginning of the training. In session 2, we really move into recognizing certain types of sexual aggression and what that looks like in bars. And we also talk a lot as well about specific tactics. And so some of the tactics that we've used for de-escalation are taken from law enforcement training. Others are taken from other literature about how to de-escalate hard situations, especially when there's an emotional component involved or a perpetrator who might be under the influence of alcohol or other drugs. So we really get into a lot in that second session of 3 hours. What are the situations? Let's practice recognizing them in videos and examples. And let's also talk about how you would intervene. What would that look like if it occurred in this bar? And really working through those strategies of which strategies do you use in what situations as well. And so when our bar alliance formed, we had to come up with membership criteria. We came up with promotional products for recruitment and that things that they could put up in their bar to say, yeah, we've been trained in this. Check us out. We're here to keep you safe. We've got your back. And we developed the training collaboratively. So anytime we added training components, we talked to bars about it and said, is this relevant to you? Does this speak to you? Help us work through this and make sure that we're giving you something that you can use. We're not going to get in here and waste your time with strategies that aren't going to work in your environment. So we did everything collaboratively with our community buy-in. So we got our logo going on. Interesting thing about this, it used to say Arizona Safer Bars Alliance, preventing sexual assault. And there was an attorney who said, actually, that's a liability issue because you don't know that you're preventing sexual assault. And if you say you're preventing sexual assault and then somebody gets sexually assaulted, you potentially have liability. So we changed it to working to prevent sexual assault. Lesson learned. we came up with ASBA materials. So we have coasters, we have stickers, we have all kinds of various posters that bars are able to put up. When bar staff go through training with us, they get materials. So they get their manual, they get all those materials that they can go back to if they ever need to remember, like, what do I do in this situation? What were those strategies they talked to me about? But we also know that bar members might switch to other bars, right? And so in Arizona, certain types of training are mandated for bar staff, others aren't. And so for bar staff, having additional training that's not required of them is an asset on their resume when they go to get another job at another bar. So part of the collaboration and getting bars to want to do this training was being able to give them things that they could put on their resume for when they go to apply for other jobs in the service industry. So they get things like wallet cards saying that they've completed the training and that they're good for 1 year. They get a certificate of training that can go in their employee file. And if they want it, they also get a t-shirt with the ASBA logo. And every establishment that gets trained also gets a window cling that can go in their door or other window. And every year, it changes whether it's horizontal or vertical. And it has the year on it. So if you, as a patron, go to a bar and see that they're ASBA trained, you know if they're up to date on their training or not. Because we don't want bars getting the cling, and then a few years later, all their bar staff have turned over. They're not really trained anymore. So there's also an element of accountability for their training and patron safety. And then we have outreach materials, right? Because you can't just go into a bar and say, hey, we've got this really great training, you should do it. They're not going to jump up and down and say, okay, sign us up, let's do it tomorrow. That doesn't really happen. Being able to have things that you can leave with them, especially if you go in and maybe there's wait staff, but the owner is the one who needs to make that decision, you need to have things that they can give to the bar owner later. So we have brochures and other little cards that we leave for them that they can give to the owners or managers to learn more about the program. And then we follow up. We follow up with calling them to say, did you receive the materials? Let's talk through what this is about. Let's talk through why your bar might want to do this. And then if they're interested, we set up a time for a training with them. Some bar staff or some bar owners or managers are still a little bit like, I don't really know, can we talk about this more? And so we'll set up an in-person meeting with them and maybe go through one of the modules to show them what the training is like. So there's a lot of legwork that's involved in actually getting the program set up and in getting bars recruited. A lot of times, because this is so new, they might not have heard of it before. They don't know if other bars are doing it and if it's worth their while. And it's not something they normally do. They know that there's other training they do, like drunk driving prevention, but they're not really thinking of injury prevention in terms of sexual assault prevention. And so it's really a new concept. It does take a lot of legwork to get bars involved, but once they agree to do the training, almost all of them actually follow through with the full 6 hours. That's been our experience. So we pilot tested the program back in 2012, and it was pilot tested in Flagstaff, Arizona, which is our 3rd largest city up in northern Arizona, and it has 2 college campuses. It has a community college, and it has one of our large state universities, one of our public universities. And around that college campus, there's a high density of alcohol serving establishments, and so those are the establishments that we targeted for training. And there were actually 4 trainings that went on, but only 2 of them had usable data. And the data that is up here right now is only from people who did the pre-training survey and the post-training survey. So this doesn't count people who only did one or the other. And so some of the things that we learned from that were a little bit different than what we thought they would be. We kind of assumed that around a college, it's mostly going to be young servers who are new in their job and maybe don't really have a lot of connection to their bar. We actually found the opposite. Most of the staff who were working in our alcohol serving establishments were older, or at least not like in undergraduate age. And most of them had been working there for 5 to 10 years. So this is really their investment. This is their thing. Their bar is their turf. They have a lot of ownership about it. And so that's good. It's a double-edged sword. On one hand, it means that they care about what happens in their bar. On the other hand, it means you gotta respect that you're going into their bar and telling them how to do their job, right? So it's really a lot of relationship building and going in and saying, let's work on this collaboratively. How do we look at your specific environment and talk about what's going on in your life? So we take that into account in the trainings. And so that was a learning experience for us. It was very different than what we assumed going in. And we had some really good results. So we found that the training increased people's self-confidence. People thought, wow, you know what? I think I could do this. I think if I saw something going on, like, you know, if there were bar patrons who were making sexist remarks or things that are degrading toward women, I think I could do something about that. We also saw that people really wanted to take ownership themselves. There was a lot less, well, I'm going to tell somebody else to do it, or I'll just tell the manager about it, or I'm not really sure what to do, so I'm going to wait and see if somebody else does something. We saw a lot less of that at the end. That was really cool. And we also saw that people knew afterward what being an active bystander meant. So actually going into it, most people in the trainings didn't know what bystander intervention was, or really have any concept of what that meant to them. So we did really good in the knowledge and attitudes section, right? Hooray, we changed people's knowledge. That was really cool. But did we change their behavior? We didn't really know. There were some limitations with this study. So first of all, not a lot of people completed the before and after surveys. And when you have very few people completing, you don't know if those findings are just by chance, right? We had really limited data on peer support. We know in sexual violence prevention that peer support can make or break an aggressive situation. If people have a peer network that supports sexual aggression, they're more likely to engage in sexual aggression. They're more likely to perpetrate. If they have a peer support that says, you know what, this isn't really cool with us, then they're less likely to. And so peer support has a lot to do with how people behave, and we didn't have a lot of information on that. We also didn't have long-term measurement of people's behavior. So we knew that they learned stuff in the training, but at that point in time, we were not able to do more long-term surveys with folks. We weren't able to really get it off the ground to be able to look and see a few months later, were people actually using the skills that they learned in this training? So that was a limitation for us. And so we had done all this work for years to develop this program and get all our materials together and get some bars trained. And then we got this data that said, well, you did like kind of a good job, but we're not really sure if you did a good job. We think you did, but we're really not sure. And so we halted. We had to make a decision that, you know what, we think we're doing a really good job, but we can't keep moving forward if we're not really sure of what we're doing, why we're doing it, and how we're going to evaluate it. So we had to stop for a minute. And this was at the beginning of 2014. And so we really had to take a look at our program, the curriculum itself. What were some of the good things? What were some of the limitations? We had to look at, do we know why do we think this program's going to work? How is it supposed to be working? And what exactly are we supposed to be evaluating here? We weren't sure, because one of the things that we experienced with that first pilot was that our surveys didn't see a lot of change from beginning to end, and we didn't know if that was because the program wasn't doing its job or if our evaluation wasn't doing its job. For example, a lot of the knowledge questions were really, really easy. Somebody without training probably could have answered them correctly the first time. And that's what we saw. So there wasn't a lot of change there. So we really had to evaluate our evaluation and see, are we measuring what we want to measure? So we stopped and we created a program logic model. We had to really think through step by step, what are our community assets? Who's out there to help us? What kind of inputs do we have? What do we expect to get out of this? How many bars do we want to train, and by when? Like, what are our goals here? We also had to look at, what are the outcomes that we really want to see here? Specifically, not just preventing sexual assault, not just we hope that people's knowledge and attitudes change, we hope that there are safer bars, but specifically, what do we want to see? We had to really think through those things, because if you don't know why you're measuring things, and you don't know specifically what you're measuring, then guess what? You're probably not going to measure it when you do your evaluation. You're going to waste your own time. You're going to waste your participants' time. We did some curriculum mapping and revisions. We went through our curriculum to look at, are we teaching people the things that we said we want to look for in our logic model. In our logic model, we put all these outcomes. Are we going to get to those outcomes with the curriculum that we have right now? So we had to do some curriculum revisions. And also looking at, are we spending enough time on the places that it's harder to get to outcomes at, right? And so we did some curriculum revisions. We did that in timing, we did that in content, and we also did that in visual appeal, right? So a 3-hour training that is a bunch of bullet list PowerPoints is not going to be very engaging to people. So we really ramped up the interactive activities. We also changed the visualization of how it looked. So we got rid of all of our bulleted lists and made them really pretty. We had a fabulous intern last spring that overhauled the entire curriculum design, and it's beautiful now. But we had to take the time to do that. We also came up with a theoretical model. We know that in public health there are some theories about how people change and why. And so we thought, which one of these applies to our curriculum? What's the mechanism of change here? Are we changing people along stages of change? Are we changing their behavioral intent? That's what we're doing. What are we doing? We had to figure out the why of what we're doing, because even though there's a huge literature on bystander intervention and how great it is and why we think it works, we don't really have a lot of evidence on why specifically bystander is pretty effective at changing people's behavior. So we wanted to ask that question. We said, go big or go home. We're going to ask, why does bystander work? We also revised our evaluation. So we completely overhauled the evaluation. And there were a lot of things on there that we had to change. We had to figure out, how do we evaluate the outcomes that we put in our logic model? How do we specifically get to those things? Especially in sexual assault prevention, we know that we have to ask certain types of questions. If you just go out and ask somebody, hey, did you let somebody else get raped after they went to your bar last night? I mean, that's intrusive. They're probably not going to say yes. If you go out and ask somebody, have you been raped in a survey, you're not going to get as many people saying yes than if you ask questions that are behaviorally based and get at specific behaviors. We also sort of shifted it in timing. So one of the things that we notice, and a lot of people make this mistake in their evaluations, is that our post-survey, the post-training survey, was asking about things that they didn't have time to do yet. So in our post-survey, the original post-survey was asking about bystander behavior. Well, the post-survey was done at the end of the second session of training. They just learned those tactics. So unless they used bystander behavior on the break during the session, we're not going to see any change in their behavior at that point, right? So we had to really think critically about the questions we were asking and whether they were appropriate. And then we also designed, based on our theoretical model, what things should we be looking at pre, post, and 3 months later. 3 months later is really where we're going to be looking at behavior, and that's something we're rolling out this fall that we're very excited about. We also had to do fidelity monitoring tools. So this curriculum is being implemented throughout our state. And so we need to know, for evaluation purposes, are all of our trainers implementing the entire curriculum? Are they implementing it the way that it's written and the way that it's supposed to be facilitated in order to get to the outcomes we need? Because what happens if we get really great training results in Flagstaff, but we're not seeing very good results in Tucson? We need to know why. We need to know, is it because there's something different about the population in Tucson? Or is it that our trainer doesn't really believe in this part of the curriculum and they skip it all the time? Or maybe they spend too much time at the beginning and never get to the stuff at the end that's actually about intervention, right? So we developed fidelity monitoring tools that help our trainers to evaluate themselves and how well they are doing and how often they're implementing different parts of the curriculum. And then we also developed tools for us to go out and be able to sit in on their sessions and evaluate them as well. And then we can also give them the feedback that they need as trainers. Because like I said, this hasn't really been done before. And so a lot of our trainers, even though they might have experience in sexual violence prevention, maybe they've taught classes or prevention workshops before, they might not have necessarily taught this type of course and not necessarily to this audience. So we've really had to think through, how do we provide them with the feedback they need so that they can become better facilitators? We also came up with a 5-year plan. So last year, we had to, revisit our state plan for sexual violence prevention, right? So it was an 8-year plan. It was created in 2007, so we thought, oh my God, it's 2015, we need a new plan. So we went through this process of creating our new state plan, and part of that was specifically coming up with a plan for this program. And that's something I really recommend people do. In the beginning of getting a program off the ground, you're very excited, you're doing everything you can to get it off the ground. Just getting anybody to come to the training and be a part of it feels like a success, and it is. But if you don't know where you're going, it's harder to get there. You lose motivation and steam pretty quickly. Come up with a plan, come up with your objectives, and give yourself the tools you need to know whether you're meeting those objectives. You have to have a plan. So that's what we came up with. And we also came up specifically with an outreach plan. So we contracted with a media agency that came up with maps of our 3 major cities, and then divided those maps, color-coded them into the places where there were really high densities of alcohol-serving establishments. And then our media consultant actually helped us to come up with which bars should we be targeting first and in which locations, and also helped us to come up with things like scripts. What should our recruitment folks be doing when they go in? What exactly do they say to get people on board? So we had professionals contracted to help us with that media and outreach plan. And so one of the things I really wanted to talk about in this session today is the theory of planned behavior, because this is what we based our program on, and I think that y'all will find it helpful as well. Because when you're coming up with a program, you can't just base it on, we think this is a good idea. We do that a lot in prevention, but we shouldn't. You have to have a theory for why are people change. How do you expect people to change in this program? And what the theory of planned behavior tells us is that people come into a situation with all kinds of stuff, right? They've got their personal characteristics. Maybe they're a survivor themselves. Maybe they've had previous training. Maybe they have aggression towards women. They come in with their own stuff, beliefs, ideas, values, all those personal characteristics. They're also maybe in a certain environment, right? And so for this particular program, that environment is a bar, right? So they might be really gung-ho about sexual violence prevention, but they're going to have a really tough time implementing that knowledge if they're in an environment that really values putting women down, or maybe really easily facilitates sexual aggression, right? So they come in with this baseline of life experience and environment. This theory tells us that the way you change people's behavior is by changing their behavioral intent. So people have to want to behave in a certain way before they can behave that way, right? You can't just change people's knowledge. You have to change their motivation to behave in a certain way. They have to come out of it thinking, I am going to do this. I have a plan for how I'm going to do this. I'm going to do it. I feel like I can do it. And then you see their behavior change. And theory of planned behavior has been used a lot in public health prevention programs, including in sexual violence. And there is research that shows that sexual violence prevention programming that follows theory of planned behavior is pretty effective at changing the way people intervene. And so behavioral intent, what exactly does that mean? You got to know what behavioral intent means before you can evaluate it. And behavioral intent is made up of 3 different categories. And the first one is people's attitude toward the behavior. And so that basically means, do I even think this behavior is a good idea? What's my attitude about it? Behavioral intent also has to do with peer norms. So what do my peers think about this behavior? Behavioral intent also has to do with what we call perceived behavioral control. And that is basically people's self-confidence. Do I think I can do this behavior? And you have to change all 3 of these in someone if you expect behavior change from them. And so this feeds into your evaluation as well. You need to know, where were people's attitudes toward behavior and did I change that? What are their peer norms in their bar and are we changing that? And What's their perceived behavioral control, and are we changing that? Are we changing people's self-confidence to be able to intervene? And so when we put that into a bar bystander setting, that might look at their attitude toward intervening. Do they think that bystander intervention is a good idea? It might also look at their rape supportive beliefs and attitudes, because that has to do with somebody's attitude toward intervening. If I don't see sexual aggression as a problem in bars, why would I intervene? Not a problem to me. I don't really care. I'm not going to waste my time on it. So we need to know all of these things about people's attitude toward intervention. In terms of their peer norms, in a bar, we're looking at coworker support. So that goes back to, where was it? Ownership buy-in, right? We need to know, do the owners buy into this? Do the managers buy into this? We could train all kinds of people, but if their owners and managers aren't going to let them intervene, that's a problem. So we got to look at those peer networks, whether it's horizontal, so their own coworkers, and whether it's vertical, like their managers and owners. And for their behavioral control, could I actually intervene? So some of the things that we're looking at right now in our evaluation are, did people recognize situations? Did they intervene, and what kinds of intervention did they use in each situation? But also, what about those situations where somebody wanted to intervene, but they couldn't? What are the obstacles that kept them from intervening? Was it that it was crazy busy and they're a bartender and they couldn't get out from where they were to go intervene? Is it that their manager told them, you're not allowed to intervene, you need to call me to intervene? What are the barriers that come up? Because we can give people a lot of tools, but we also need to work within their environment and what's going on with them. So that's something that helps us to improve our training later. And so we've got this really great theory, but we need some other things to get it off the ground, because a theory is not gonna magically change people's behavior on its own. And when we're starting a program, we're very gung-ho to do all the things. We really want to get this program going, but there are a lot of little questions to be answered, and it gets really overwhelming. So what we're going to do is work together to figure out what are all those things we need to think about. So I'm going to ask you guys to get into groups. You can feel free to move chairs around if you wish to make it a little more accessible. If there are people here that are from your own community, or you're here with a friend or coworker, be in the same group together. I don't want to split up people who know each other. And what I'm going to do is give each group a different category to work on. So it might be something like curriculum development or evaluation. And you can think about, who would do this in my community, or in our community if you're with a group. What would that look like if you have the category train the trainers? What does that look like? Who develops the train the trainer training? Okay, so think about that. And I'm going to put up guiding questions for each group as well. So you'll each get a category, work on answering those guiding questions, and then we're going to come back and talk about what you came up with for your communities. And then I'm also going to tell you how we've done it with ASBA. So here are some guiding questions that you can think of. I just gave you all the general categories. These are not necessarily all the questions, but maybe some things that can get you going with conversation starters. And just an FYI, at the end of this session, you're going to get all of this for every category on a handout. So again, don't feel like you need to write down everything here. But in your own groups, these are some questions that can help you get started thinking about staffing problems, or how do we develop a curriculum, how do we train our trainers, etc. For the needs assessment, folks, think about community needs assessment and campus needs assessment. Who are the community partners who might be involved? Who are the campus partners who might be involved? What's the climate in the community versus the campus? So we've got a lot to think about. These are just some questions. If you come up with other ideas, that's fabulous as well. Some of the stuff that we did with our curriculum development may or may not be feasible in your own communities. So we actually, in the very beginning, were able to hire educational consultants who went out and did this work doing structured surveys and focus groups and things like that. And that's not always possible, right? And so if you're not able to do those kind of things, being able to have maybe conversations with an expert, or just doing your own research on how do adults learn, right? So their attention span might be different. They fizzle out at different times. What things keep them engaged? What kind of activities work for adults? How do we bring in their own personal experiences into education? So doing your own research online about adult learning theory can help you with your curriculum development. We did a literature review to figure out what does sexual aggression look like in bars, and a lot of that information is online as well, and that helped us to tailor our curriculum into all these different categories. Our sessions, we kind of had to compromise because we were trying to figure out how do you keep people's attention, but also how do we keep people coming back, because we know we need to do multiple sessions. How many sessions is too many? For our communities, 4 to 6 they weren't able to buy into, but other communities, bars might be more interested in doing 6 one-hour sessions. So really talk to your folks and see what do they think will work for them, because they might not want 2 3-hour sessions. We break them up a lot with activities and videos and moving around and talking and things, so it actually works really nicely for us. A lot of people want to stay and talk afterward, which we didn't think would happen. But again, ask people in your community, because doing many sessions and having these concrete topics in each session might work really nicely. Space the sessions apart so people have time to process. And right now we're working on a refresher curriculum. And so this might not be a stage that a lot of other communities are at right now, but it's something to keep in the back of your mind, is that bars turn over in staff. And so they need to be retrained eventually, right? And so what does a refresher curriculum look like if you go back a year later and most of the staff are still there, but maybe they don't need the full training? What are the core pieces that you need to reinforce a year later? I don't have a lot of good feedback on that because we haven't done it yet. We're actually trying to figure out, and we're talking to our bars right now, what are the fuzzy concepts? What are the places we need to reinforce during the refresher? So that's something to think about too. One of the things that we're working on right now is figuring out, do students even care that bars are trained? One of the ways that we market to bars is by saying, if you're trained, that there's a financial incentive for you, because patrons are going to want to come to the bars where they know that they can drink and have fun, but that you're going to have their back. We don't know that that's necessarily true. It's one of those things that sounds really good to us, right? We think, yeah, that makes a lot of sense. So one of the things that we're doing right now is kind of doing focus groups with students at one of our universities to talk to them about their experiences with sexual aggression in bars, but also what do they think about bars being trained? What would they expect bar staff to do? Would they even notice a window cling that said this bar is trained and this one isn't? So really kind of getting into that nitty gritty too. But right now, the way that we're kind of getting this off the ground is by having we have sub-grantees for RPE that are at the university level and at the community level. And something that's worked really well for us for being able to get so involved is that our RPE sub-grantees are able to be a part of this program. So in the last round of applications, they had to choose some way to be involved with ASBA, whether it was recruiting bars or whether it is training bars. So that is now part of their sub-grantee contractual obligation. And we have regular conversations with universities about campus climate. And mostly that's with folks who are working in the prevention offices. Even though they might not necessarily be able to own this program and put it out there into the community because of institutional liability, they have students who are very excited to go out and recruit bars. And so being able to have those conversations with them gets buy-in from students and from the university. And it also helps you with labor too. Students like internships. They want ways to be involved. And this is a really good way to do that. We also have ASBA membership requirements, and those really promote community engagement for us and a conversation on sexual violence. That's one of the ways we keep it going. And we have membership requirements because it just makes it a little bit more exciting for bars to be involved if they know that they were able to meet certain standards. It's less of a, please come get trained, and more of them being able to say, you know what? Our bar is high class because we met all these standards. All y'all other bars didn't do that, so you're not as cool as us. So we've really created that culture of standards that they have to meet, and that helps them take ownership of wanting to be in this training. So that's one of the hooks we get when we get to bar recruitment. And we did a needs assessment too, figuring out what are things that might be driving this community to be motivated to do this training. So in Flagstaff, there was actually, before we started implementing this, there was a sexual assault that took place in the bathroom of one of the bars. And that was a huge problem for this community. I mean, it really shook the community. And that happened to be around the same time that we were starting to pilot this program. And so there was already community conversation going about sexual assault and wanting to prevent it. So when you're doing a needs assessment, thinking about, is my community even talking about this right now? What do we do next? Good. Yeah, a lot of the things you guys came up with are the things that we are doing in our program, and they've worked really nicely. And we actually didn't start with a formal train the trainer model. We trained people in the curriculum and thought it would work out really well. And we had some bumps along the road and kind of did things backwards. We now have policies and procedures manuals, evaluation implementation guides, and a train the trainer manual drafted. And we just got through training all of our new RPE subgrantees in the training and all of those materials this summer. But having those things lined out for trainers and training them in not just the curriculum, but also facilitation skills, dealing with folks in the audience and using de-escalation tactics in case people are a little hostile, but also in monitoring themselves in their implementation. We have fidelity monitoring tools where they can evaluate themselves and sort of have a checklist of things. And then we also do observations. The other way that we're looking at fidelity is we just added to our post surveys some quantitative and qualitative feedback from participants as well. Absolutely. So right now, our program is centralized at our state health department, and we have had a lot of different ways of staffing it. So for example, we have trained our Department of Liquor Licenses and Control has liquor law enforcement officers, and so they have been trained as train the trainers, and so they can go out and do some of that staffing for us. We have law enforcement officers in another community that are also trained to be trainers or to train other trainers as well. And so, and right now we're just starting a new model of having our RPE subgrantees be involved with either recruitment or training of bars. So staffing gets really creative. It's really hard if it's just one or two people trying to do it. So doing that needs assessment and figuring out who in the campus can help us recruit. Are there people from campus or community who can help us with training bars? Bar recruitment. This one came up, I saw in a lot of groups. And so I'm going to tell you how we're doing it. And if the groups that did bar recruitment have other things to add, I'll ask you to jump in. But we've had a tough time with bar recruitment. Like I said, we have membership requirements that we use as a hook for people. And then we also have collateral materials for them to use so that it's not just you get trained and there's no recognition for it. We have it out in the public of them saying, this is what we do. And we have a membership requirements checklist that they have to meet. So they have to have 70% of their staff who regularly interact with patrons. They have to be trained. And so they have to complete a certain amount of hours. So we have all these things that they have to meet that helps them get ownership over their training and present to the community that they've done it. And for evaluation and follow-up, the university does some of the evaluation. If you have a local college or university where there are master's level students or there are faculty who might be interested in helping you with evaluation, that's a plus. A lot of our evaluation is also centralized at the Department of Health Services. Our evaluation has grown from being short pre-post surveys to being very robust, more longitudinal, and really evaluating everything from individual knowledge and attitudes to behavior change, to changes in the environment, to fidelity monitoring. It's become really robust, but it takes time to get to that place. We also get institutional review board approval at the ADHS level and at the U of A level to make sure that even though this isn't research, we know that we have the training to protect our participants. So that's something to think about too if you're working on a college campus. Sure. I'm going to actually just skip ahead and I'm going to answer that in 1 second because this is really overwhelming and there are a lot of positive things about doing a bar program. There are a lot of risks with it. And it's also figuring out how do I even get this off the ground and get people to buy in, but how do I make sure I'm giving the right messaging? How do I take care of liability concerns? And it gets a little bit crazy and wonky. And thinking of figuring out what things do we put out to the public, what do we not? Sometimes it's a compromise, because in order to get bar buy-in, they need to feel important. And being able to put out to the public, we are trained and we care about you, is important to them, and it's important to our patrons. We haven't dealt with that particular safety issue. Could it happen? Absolutely. Could it happen in any program? Absolutely. On the other side of that, if bars didn't say, we're trained and here to help you, patrons might not know that. And it might not help them to take as much ownership of it. But that's something we haven't explored yet. And it's not something that's come up yet, but I think that that's something that's really valid and important to think about when you're talking about safety in the community. But none of this happened overnight. Think about your campus community needs and assets. We all have very, very different communities, but we have a lot of different ways that we can make this work in our communities. Identify your champions. Is it RPE subgrantees? Is there somebody on your local university or college campus who will help push for this? Do you have students who want to do recruitment internships? There's a lot of ways to get it off the ground. Find them and use them. Strategize geographically and be willing to grow and change. We've had to change a lot with this program. It didn't happen overnight. It wasn't this big overnight. We didn't have bar buy-in overnight, and it's still not perfect. But you have to be willing to grow, change, adapt, and talk to other people about it. We are done. We're actually slightly over time. I do have handouts that have all of the guiding questions on them if you would like those. They're also going to be online with the slides in about a week. Thank you all so much for coming. Have a wonderful day.